And ladies and gentlemen, our next speaker for the day, Ushinna Fowler.
Alright, I want to thank everybody for coming out. The purpose of us all being here is because I want to start a foundation for cancer patients to help with the expenses of medication, transportation, and things of that sort. There are many charitable foundations in the world, such as St. Jude's Children's Christian Hospital, as well as the National Breast Cancer Foundation. The reasons for me wanting to start this foundation is because I had someone close to me die from this disease, and I also had someone close to me that's struggling with the disease right now. With so many wonderful foundations that help with the research for treatments of cancer, I thought it would be a good idea to start a charitable foundation that gives money to the families that are struggling with the medical expenses of the disease, such as hospital bills, medication, and other expenses of that sort. And you may be asking yourself, why donate to my foundation when there are so many others out here that exist? The answer to that is, why not donate to one of your peers who has such a bright idea to help so many others and become a part of making this foundation a success. Today I would like to talk to you about some of the related expenses of having a loved one with cancer, such as treatment-related expenses, clinical trial expenses, and prescription expenses. Treatment-related expenses are costs associated with treatments of cancer, such as chemotherapy and radiation. High out-of-pocket costs have led many patients to forego particular therapies. One study has found that treatment-related expenses consume 27% of the annual income among low-income cancer patients. Clinical trial expenses are part of a long, careful research process. This process is done to find out whether promising approaches of treatments are safe and effective. A number of studies have found that patient care costs, clinical trials, are not higher than costs for patients enrolled in the program. The most important expenses costs associated with prescription medication. This is one of the most quickly rising, confusing aspects of cancer care. The latest research show that around 800,000 people every year cannot afford their prescriptions. The newly released Macmillan survey of 447 patients found that 47% had to cut back on essential items like food and heating to pay for medical expenses. Cancer patients are struggling with the cost of long-time drugs. Almost two-thirds, 59%, had also cut back on entertainment and leisure activities. People should never be forced to choose between food and medication. People with cancer's main focus should be trying to get better and not how much their medications are going to cost them. Cancer patients have so many aspects to worry about, so someone else should worry about the medical expenses. How cancer patients can benefit from this foundation. This foundation will help you with medication and transportation expenses, give the families a chance to sit back and take a deep breath knowing that there is help out there with such costs. I also hope that they will be at ease knowing that I am not in this for sympathy, but to give my help because I know what they are going through because I've been there myself. Not only will they get the assistance, but along with that, they will get a friend because I plan to get to know each family we help. With your donations, we will help someone's grandmother, grandfather, mother, father, or even someone's child. They will also help the family relax and breathe from some of the stress that comes along with all the expenses. Not only will this help the patient and their families, but it will also help make this foundation a success, which in turn should give you a sense of pride, and hopefully you will feel like you help take some of the pain away from these struggling families. So today we have learned that there are patients that cannot afford all the expenses that comes along with having cancer. There are families going into debt just to make sure that their loved ones get the medication and the care they need. But we have also learned that there is a way we can help with just $1 donation. Just think, that is $1 more that a struggling family does not have. As I bring this to a close, I would just like for each one of you to close your eyes for one moment and just think. What if your mother, father, grandmother, grandfather, or even your child came to you right now and told you they were diagnosed with cancer? What would you do? Or better yet, who would you turn to for help? Now for all those that have already been placed in that situation, just think how having to help with all the expenses would make things so much more at ease for you. All I'm asking is for everyone to put themselves into the struggling family shoes and just open your heart to the idea of being a part of something so wonderful. I want to thank everybody for coming.